these are very, very serious medical problems that if we were better at educating our people, we would have a lot less disease. Now, let's say that you know about that and you incorporated resistance training and weightlifting, and, let's say it's someone like you that knows about it. There's still a possibility that you're going to get breast cancer.
Hmm.
It might not be because you have metabolic dysfunction. 80% of breast cancers are a combination of metabolic dysfunction that lead to immune dysfunction. And we know that for 5 or 6 hours after you consume sugar, your natural killer cells are inactive, right? That is your surveillance system for cancer.
Dr. Jenn Simmons, welcome to the Dr. Tina Show. I am so excited to have you here today. I have been sort of Instagram stalking you for several months now, and I'm really honored that you made some time to be on the show today.
Well, I love all my nice stalkers. It's the ones that are not so nice that I could live without. The trolls, right?
Yes, yes, we all have them. I just think you're such a badass because you are speaking out against something that conventionally has just been so standard in medicine. And we're going to talk about it today.
Yeah.
And you're an MD and you're speaking out against mammograms, basically, is what I've seen, which I cannot wait to get into with you. Tell us about yourself. So, you're an author, you're a podcast host, you've had breast cancer, from what I understand. And I would love to hear more about your story.
Yeah. I haven't had breast cancer, so I do want to clarify
Oh,
that.
I'm sorry. I
But I
misunderstood
did,
that.
no, that's okay because a lot of people think that. And in many ways, well, I come from a breast cancer family. And I had a first cousin when I was growing up. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. I think you're too young to know this, but she wrote 54 hits in all, and her most
Wow.
famous song was The Greatest Love of All.
Oh, wow.
Yeah. So, there wasn't a person on earth that didn't know that song. And even for decades later, I mean, even my children who, were born many, many, many decades later know that song. And when she wrote that song, she wrote it in 1977 as the title track to the movie The Greatest. And at that time, it got some acclaim, but it really received its acclaim when Whitney Houston released that song in March of 1986. And at that time, it would spend 14 weeks at the top of the charts. Only Linda would never know because she
Oh,
died of metastatic breast cancer just 1 month after Whitney released that song.
oh,
She is one of the many, many, many women in my family with breast cancer. Breast cancer was the writing on the walls for me my entire life. But when I was 16 and Linda died, I mean, it's hard to lose your hero at 16. And her life and her death gave birth to my life's purpose
oh, wow.
because I knew that I wanted to do something so that women, families, communities didn't have to suffer the way that my family suffered. And I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. And I did that really well and for a really long time. I did it long enough to diagnose my aunt, diagnose my
Wow.
mother. It was about, let's call it 15 years into my career. And I get diagnosed with Graves' disease. So I go from being probably one of the most high functioning people that you've ever known to I can't walk across the room. I don't have the breath in my body. And I'm sitting there in the office of my friend and colleague and physician, and he tells me that I need surgery and chemo radiation, and then I'm going to be on lifelong hormone replacement. And I'm having an out of body experience. I mean, these are things that I tell people to do all day, every day without hesitation or reservation. But when the words are coming at you, it's like you're in some crazy, surreal place. And it didn't help that 10 years before my aunt was diagnosed with breast cancer, she was diagnosed with Graves' disease.
Okay.
So for me, this really was the writing on the walls. Even though my entire career, I anticipated getting breast cancer. But when I was on the precipice of that, it was really the first time that I asked, are we doing it right? Is this really what we should be doing? Is this really what I should be doing? And I left my doctor's office and refused treatment. And he told me I was going to die. Just like I had told the many women who asked me, like, what happens if I don't treat my breast cancer? And I told them, you're going to probably die of breast cancer. And I believe that to be true because that's what was taught to me. And that's what was taught to him. But something about it, I don't know what you want to call it. You want to call it universe, you want to call it God, you want to call it whatever you want to call it. Something said to me that there's another way, go find it. So I set out on a journey to find it. And I went to a place that I tell everyone never to go. Now, bearing in mind, this is like 2016 or 2017, and I go to Dr. Google. Now, Dr. Google now is not a place where you can find the truth or anything useful. But there was a time when certainly information was more available and less contrived.
Yeah.
Right now, we are being fed a very specific narrative.
Yep.
And, it took a lot to even train my chat GPT to stop lying to me,
Yep.
right? Like the narrative is being tightly controlled. And if you're not speaking that narrative, your voice is silenced.
Yep.
So, but at that time, I asked Dr. Google, how do I heal from Graves' disease? And again and again and again, and Graves' disease is an autoimmune disease. And I'm hearing diet, 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 diet. Now, as a conventionally trained physician, we get about 15 hours worth of training around nutrition in our first year of medical school and never again. And bear in mind, I'm a board certified surgeon and a fellowship trained physician. My higher education numbers are astronomical. 15 hours of training is nothing, nothing. And we're kind of taken through medical school suffering this horrible, horrible belief that if it wasn't taught to you in medical school, it's either not true, not important, maybe both, right? And so we come through thinking that food doesn't mean anything, nourishment doesn't mean anything. It's just like things that people in third world countries have to worry about and not so much here. And we were still brought up, and I think it's still happening now where, all calories are equal. And as long as you meet your caloric needs, you don't have to worry about anything. And it's just simply not true. So I decided that I would learn more about nutrition and nourishment and that kind of thing. And I started at a certificate program, like a nutrition coaching program called IIN, the Institute for
Yeah.
Integrative Nutrition, which, listen, it's a great basic information training program for people who are just starting out in the wellness space and want to grow a career in the wellness space. Me, I approached it with a ton of trepidation. Like, here's my snooty booty self saying, am I really going to learn anything? Like, I've been a doctor for 20 years at this point. Am I really going to
Wow.
learn anything? So they assured me, yes, yes, yes. And I go and I'm listening to one of the very first speakers, and Mark Hyman walks on the stage. Now, this is 2017. I have no idea who he is.
I love
And
this story.
yeah, like
So
I'm
good.
completely steeped in that conventional medical world. I have no idea who he is. He walks on the stage, introduces himself as a functional medicine physician. I'm like, there's no such thing as a functional medicine physician. What is
Wow.
this quack talking about? Right. And then I remember that I'm sick and I'm there for a reason. Check my ego at the door, shut down my mind, open up my ears. And thank God I did.
Oh, I love
Because
this.
within moments of him speaking, he basically telescopes the rest of my life. And I understand almost immediately why I got sick. I got sick so that I could be in that room on that day listening to him speak. because he is explaining not only why I'm sick, why everyone's sick. And I learned from him in the subsequent, 2 hours that he spoke, and then again and again and again later on, because I'm an early adopter. So, I'm so fascinated and hanging on to his every word that I'm like, I need to be a functional medicine doctor. Like, how do you do that? I sign up that day for the Institute for Functional Medicine,
Yeah.
and I spend the next 3 years just immersed in the study of functional medicine. But, what I learned from him is that we're all focused on the wrong thing. We're
Mhm.
totally focused on the symptom. And when you're focused on the symptom, you don't solve the problem.
Yep.
So you can cut all the tumors out that you want. Unless you change why someone got breast cancer, you're not helping them. And the treatments that they were advocating for me for my disease wasn't going to change if I got breast cancer, because all they were doing was removing my thyroid. My thyroid wasn't the problem. My thyroid was the canary in the coal mine.
Yep.
My thyroid was the one saying, like, hey, this isn't working for me. I need help. And not that help. Right. And so I spend the next 3 years trying to heal myself. It got way worse before it got better. And I was on my way to an MS diagnosis when I finally I was trying to figure it out for myself, and then met Terry Walls, reached out for help. And it was really only then that I was able to do the deep work and figure out what was going on and really change things around for me. But, you know, I walk a tightrope. Like, I don't have the luxury of falling off the wagon, because I know what's waiting for me on the
Yep.
other side if I do. And so I walk the line because I have to walk the line. Not everyone has to walk the line, but this is my lot in life, and it's fine because it's good and I'm happy and I'm healthy. And it has become this amazing thing for me because I was able to truly see what my life's purpose is, because I knew that I was put here to help. I knew I was put here to change the conversation around how we diagnose, treat, and recover from breast cancer. I know I was put here on a mission to figure out how to prevent breast cancer, but I was on the wrong path. And I could have never found my way to this path. I could have never removed those blinders without this experience. And so I talk about all the time, we don't have to be grateful for our illness, right? Cancer is not a blessing. Autoimmune disease is not a blessing. It sucks to be sick. It sucks to have to face your own mortality, for sure, right? But if you can see it as an opportunity and take advantage of that opportunity, it's an amazing, amazing gift.
It is.
And
The universe has a way of forcing you to veer.
yeah,
It gives you that signal if you listen.
but you have to be willing and you have to listen.
Yeah.
And for most people, the whispers are there, but they don't listen. I know they were there for me and I didn't listen. And if you don't listen to the whispers, you get screams.
Yep. It's so true. No, that's a very common story too, that we find our way to this medicine through our own journey
Yeah.
often. And,
Yeah.
I always say the universe will find a way to bitch slap you down if you don't listen. I mean, there's times when it will halt you in your tracks. And
Yeah.
that's always a great opportunity to reevaluate your life and your choices and
Yeah.
how you're moving forward. So no,
Without,
I appreciate you sharing that story. So I'm a naturopathic physician, and I was going pre-med in undergrad in the 90s, and I met a naturopathic physician, and I ended up working for him in his office as a receptionist. And I had wanted to be an MD my whole life. And when I met this man, I was like, what is this? Like, what is happening? And this is in the 90s, and
yeah.
this is long before IFM. And truth be told, Jeffrey Bland worked at the naturopathic school up in Seattle and took our medicine and put an algorithm on it and turned it into functional medicine, which no
Yeah.
disrespect to functional medicine, but like we're the grandmother of that,
For sure.
and
Without question.
and just to see it change and morph and to see so many cool doctors like yourself sort of, I always say, welcome to the dark side, but really it's not, it's the light side,
It's
but like,
welcome to the light.
yeah,
It's welcome
welcome.
to the light.
We're
Yeah.
just the renegades,
Yeah,
and it's punk
someone
rock
reached
over
out to
here.
me recently. He is a PM&R physician, physical medicine and rehab.
Yeah.
And he somehow found out about functional medicine and is in the process of training at IFM. And he emailed me today. And my response with him was, welcome to the light.
Yeah.
Welcome
Yeah.
to the light. And how lucky are you that you met a naturopathic physician? I never met a naturopathic physician before I went to train in functional medicine. I didn't even know what it was. I never heard of it. So
It's
you were so lucky. And I am 100% certain that had I met a naturopathic physician in my fundamental years, I would have done that instead. I became a doctor because I thought that was the only choice.
right.
Like
Yeah.
I knew if I was going to change the world, like there were only so many choices. So I became a doctor. Like I knew that probably doing nursing was not going to be enough. And that's what I thought I needed to do. I somehow intuitively knew not to go the pharmaceutical route. So I'm proud of myself for that. And listen, my years as a surgeon, my 20 years as a surgeon was not time lost,
Oh,
right? I
no.
have a
No, that's
perspective
incredible.
that is irreplaceable. And when people talk about how these things work and what's happening to them, I deeply and totally understand what's happening to them because I've lived every single part of it. I've seen it, I've touched it, I've smelled it. I know every single thing that's happening because of my surgical training,
Yeah,
because
absolutely.
I had to be a surgeon, because I had to be a medical doctor, because I had to be all of those things. It was irreplaceable. And there are so many doctors who are amazing, wonderful doctors who are afraid of cancer patients because it's like, even though they know all the right things, they know that at the end of the day, health is health. And we all know how to drive health. And yet they're so afraid of people with cancer. And I'm not. Right? I ran a cancer program for 15 years. I'm not afraid of people with cancer.
Yeah.
And so my experience has been the greatest privilege. I mean, to have had the opportunity for people to go to sleep and trust me 100% wholly with their life and to hold their life in my hands, like there is truly no greater privilege. And I am so grateful to God for having given me that skill set to be able to do that for as long as I did it. And I didn't leave because I lost my skill set. I left because I knew that there was a better way. And when I was a surgeon, yes, I was helping that one person in front of me, but I wanted to help a million people in front of me.
Hmm.
And the only way to do that was to make this transition.
That's so badass that you were a surgeon. That was the route. If I had lived a different life, I was actually going to become an orthopedic surgeon. And I didn't. I ended up meeting my mentor and I spent 20 years mentoring with him. So I'm a chiropractor as well. And I did a ton of regenerative medicine. That's what I did in my practice for over a decade was inject joints all day and
Hmm.
treat musculoskeletal concerns with, regenerative therapies
Hmm.
long before it was cool. Like I was doing old school prolotherapy and PUA back in the
Yeah.
day. And people are like, you do what? But a female doctor that works with her hands, I think is a very special person. That is a whole different skill set and it requires a whole different part of your brain. And I think it gives us, I don't know, it's like a superpower and it gives you a perspective that is unique when your medicine isn't just coming out of your brain, it's coming through your hands too. So I don't know.
Hmm.
I commend that. I think it's super cool. Um,
Well, I'm very much a tactile person. So it was an easy fit for me,
yeah.
just a very easy fit for me that, I love puzzles and I love putting things together and I love making things beautiful. And yeah, and oncoplastics was really, I'm a problem solver. I like to fix things. I'm a people pleaser. Like it was really the perfect place for me. Like, let me solve this for you. And then I literally physically got to solve it for them.
Yeah.
So it was a very good fit for a very long time.
Yeah. And such an important skill to have. I mean, we need good surgeons in that arena. I've had several friends in the past few years go through breast cancer and reconstruction, and to lose your breasts is, I
Yeah.
don't, I
So
don't think
I
men truly
feel
understand what that
I feel
means.
very differently about it now than I felt about it then.
Yeah. I'd love to
Um,
hear your perspective because way back in the day, I grew up in Southern California and then moved to Oregon. My best friend in the whole world, we're still best friends after, gosh, almost 40 years now. And I remember talking her out of, for years, for decades, talking her out of breast enhancement surgery. I was like, do not mess with the tatas. Do not. And
that was very good advice.
I find it very interesting that this, and so then flash forward, I'm in chiropractic college and we actually dissect our cadavers day one. We start, it's very hands on. We're chiropractors. And my cadaver, by the time we got to her breasts a few months in, she had these opaque black implants that we took out of her.
You know
And
what was in there, right?
I'm sure it was mold and
Mold.
bacteria.
Yeah.
Yeah. I mean, I was like, and then she had metastases of bone cancer throughout her entire skeleton. And I remember
Probably
this.
because of the mold in her
Yeah,
implants.
exactly. And I begged to have it sent off for evaluation and they wouldn't pay for it. And I remember thinking, damn, dodged a bullet there without ever, never messing with my tatas, because I absolutely agree with you. I didn't know what I know now, but at the time I was like, I had worked for a naturopathic doctor at that point for 10 years. So I was like, this is mold and this is probably what gave her cancer. And the chiropractors are like, oh, that's ridiculous. But whatever, they've come together. It's really cool. I think a lot of the professions have come together as of late, but back then there was turf wars. And
Yeah.
so I just really inherently, and I haven't delved deep into the breast implant illness conversation with anyone. I've just always inherently thought it was a terrible idea, to be honest with you. And I wonder how it's so weird to me that the standard of care with breast cancer is to remove the cancerous tissue and then put an implant in, which I know we don't have direct, maybe you know the literature better, I'm sure. I don't know if there's a direct linkage between the implants and breast cancer, but it just certainly doesn't seem like a great idea. And so I don't know, I'd love to hear your thoughts on that. I'm not,
Of course, it's a bad idea. I
yeah, okay.
mean,
I'm not throwing anyone under the bus to all my listeners. I just inherently have always felt that implants were a terrible idea. So,
yes. Yes. And listen, people like Dr. Rob Whitfield have made entire practices on the dangers of implant and breast implant illness. You're taking a population of women who have already demonstrated that their immune system cannot handle the world around them,
yes.
right? Because that is what cancer is. It's a failure of the immune system. We all have an immune surveillance system that should be traveling around our body all the time looking for cancer cells, because everyone makes cancer cells, from the
Yep.
very young to the very old, everyone in between. But someone with an intact immune system should be able to navigate that, destroy them before, tell them that, hey, listen, you're not good, go away. And that should be able to happen. And they should never be able to gain mass numbers.
Yes.
So people with cancer, their immune system has already said, like, I'm out. I can't handle what is going on. I can't protect you. And we take that same person and we put an implant in them. I mean, it is just crazy. And, it's a plastic bag with either saline or silicone in it. And it's a problem, right? And so, yes, your body will wall off around it, but it's not enough. Not enough.
Yeah. I was so excited to have you on to ask you that question because to me, it just seems crazy that that's the standard of care. I understand that women don't want to have no breasts. I get it. I mean, there are breasts. This is inherently female. I get it. And I cannot put myself in someone's shoes until I've been there, right? Like I can only imagine what that diagnosis would feel like, but it just seems like a wild concept for exactly the reason you just said. You nailed it. Yeah. So what are some solutions? Are there any? Is there anything else that people can do? I mean, I
Well,
can't.
I was saying that I feel completely differently about mastectomy than I felt when I was in practice all those years. And so now I call mastectomy what it is. It's a breast amputation. And we shouldn't think of it as anything other than a breast amputation. Is it necessary sometimes? Yeah. But the number of mastectomies that are being done unnecessarily is tremendous, right? And I'm not even talking about the prophylactic surgeries, which there's way too many of those. People just removing their breasts out of fear, or, they're removing normal breast tissue. But I'm even talking about the mastectomies that are done because you have an MRI that shows extensive disease, and then you remove the breast and there's nothing there. Or the person that is under the impression that they have a more likely chance of cure, because it's simply not true. And or the person that thinks that it's going to lower their chance of recurrence, and they don't understand that it's only lowers a local recurrence, not a systemic recurrence. And the systemic recurrences are the only things that matter.
Yes.
So there are so many people that undergo this surgery and they totally unappreciate or underappreciate the impact of a breast amputation, because you will literally never be the same. Never. And it doesn't matter how good the reconstruction is. You will never be the same. And this is a huge problem, because, if you do a lumpectomy on someone, I'm not saying people shouldn't have surgery. Like, I totally get it. If you have a tumor in your breast and you want it out, I get it. But if you have a lumpectomy, a well-done lumpectomy, there will surely come a time where you will not be defined by your breast cancer. If you have a mastectomy, there will never come a day in the future, ever, where you won't remember that you had breast cancer.
Yes.
And we need to be able to move past this trauma if we're going to heal from this trauma. And it's nearly impossible. It's nearly impossible when you've had a mastectomy. And there are so many things that are wrong with the way that we treat breast cancer, but that is a huge sticking point for me. Now, for someone who has extensive disease and they need a mastectomy, I get it. I don't think that we should be removing the other side, and that whole bullshit story about, oh, well, you're going to be asymmetrical and whatever, and you should do it so they're both even. I'm not buying it. Right? Like, if the reconstructive surgeon is going to create a breast, they can do a symmetry operation on the other side and make it match. You don't have to remove the other breast. But I'm not a fan of putting an implant in someone who's already demonstrated that their immune system can't keep up. So I'm not a fan of implant reconstructions. And I understand that not everyone is a candidate for a tissue reconstruction. They're not a candidate to use their abdomen or their buttocks or their thigh, or, any of the other reconstructive techniques. But to me, there's always a way to do it better. And we need to really stop doing it badly.
You're hitting so many points that I've thought about and considered and looked into. And it really is I just feel like it's got to be a huge profit-driven industry too, just,
Of
it's just so
course.
cavalier. And it's
Of
just
course.
it's heroic medicine in general. I mean, I was telling you my background was in regenerative injection therapies, because it's that orthopedics is just heroic medicine too, oftentimes. And, oh, let's just go in
100%.
and, cut it out and give you you'll get a new knee. It'll be fine. And it's like, or we could just, throw some,
Help your
literally some,
stem cells.
or could put sugar water in there. I mean, I was doing prolotherapy. I did thousands of prolotherapy injections on thousands of joints, and sugar water would regenerate the tissue and stop the pain in so many cases. There's options, and we don't hear about them because brave doctors like you won't speak up. I mean, what you're saying is, I can imagine in your circle in the more traditional model, I mean, this is heresy.
Yeah.
So.
No, my colleagues that I worked with, I went from being like the smartest person in the room to the craziest person in the room.
I love it.
Right? Like, all of a sudden I
I
lost my
love it.
mind. I lost my skills. I lost my,
Yeah, it's all
and
over.
it's okay. I remember Terry Walls telling me, do you know Terry?
I don't know her personally, but I know of her well.
She
Yeah.
has an amazing, amazing, amazing story. I mean, she's a
Yeah.
Midwestern internal medicine physician who was diagnosed with primary progressive MS and within like 2 years went from fully functioning to a zero gravity wheelchair, got let go by the hospital, had to claw her way back to health. And the way that she clawed her way back to health is, yes, she was taking the medicines and was on every single clinical trial imaginable, but she changed her diet. She
Yeah.
mostly changed her diet. And that was a real turning point for her. And then, since then, she has taught thousands and thousands and thousands of people how to reverse their MS. And when I met her, she said to me, I don't even remember how it came up, but she said, Jen, hang in there because, for the first 5 years, I was the quack, right? And
Yeah.
then, she went from being the smartest person in the room to now she's the quack. And then as people began to see the validity of her work and the results that she was getting, suddenly she started to get invited to speak and that kind of thing. And she's like, now I'm in the like 13th, 14th, 15th year of this. And now I'm the expert. Now I'm
Yeah.
the keynote,
People are
right?
listening,
Yeah.
and you can even see it. I see the Medscape emails come across my desk, and I'm like, God, it reads like a naturopathic newsletter at this point. I mean, they're really starting to come around. It's
And
because
thank God.
yeah, because their tools are
Thank
not
God.
it. It ain't it. I mean, I've been doing this a long time. I've been in this world a long time, and I've watched it all come and go, and I've seen the social media happening, and it's been a wild few decades watching it all. And I'm just always over here like, I'll be here when you want to talk some common sense. Like that's what
Yeah.
I've been beating the drum. I mean, back when the big medicine, functional medicine influencers were saying do yoga and eat vegan, I was like, or you could eat steaks and deadlift. Like I'll be over here eating steaks and deadlifts, and I got so much shit for it, and I just kept telling people like, well, we'll see how this goes, because I mean, to me, it was like, let's just see how this pans out, and it's been decades now, and I'm 50, and I look like this and my health is fully intact. I've got some autoimmune conditions I struggle with. My grandfather died of MS, so that's always something my autoimmune disease likes to do a fun little dance with my neurologic system, but I keep, it's clean living. Like I don't have
Yeah.
any wiggle room. Like you said, you walk a line. I walk a very tight line, and
Yeah.
I always consider it it's my gift, right? It keeps me honest. And
Yeah.
I always say my autoimmune disease keeps me honest. I don't have a lot of leeway either way. And when I met my husband in 2019, I don't think he fully believed me. And now he's seen it full throttle. I'm like, I just have a funny immune system. I don't identify with my autoimmune conditions. I have a kind of a laundry list of them at this point, but I'm like, I don't want to know anymore. I don't want to die. I don't need any more diagnoses. I know how I need to
Right.
live.
And
And
the diagnoses don't help, right?
yeah,
It's just like that you have to walk the line.
yep.
That
And
if you don't walk the line, you're going to have dysfunction. And what we all want is optimal health, optimal function. We want to live a very long time and die young,
yep.
right? And, I was on with JJ Virgin yesterday. I don't know if you know JJ,
Yeah.
but JJ, her whole goal is to play big at 100. She wants to be relevant and she wants to continue to play big at 100. And she's going to,
Oh
right?
yeah.
Because she's found that recipe. And you may look at her and say, oh, but it's so easy for her. She's thin. She's this, she's that. She works really hard for her health,
Oh yeah.
really hard for her health. And she's doing all the things.
Yep.
She's doing all the things.
Yeah.
And maybe you can't do all the things, and that's fine. But there are some fundamentals that are super duper important. And I think the main thing is to not follow that conventional prescription, because
Hmm.
that conventional prescription is the road to disease. Our entire medical system is built for failure.
Hmm.
Every single thing about training in the conventional medical world is, let's see when you fail, right? Doc, I don't feel well. I don't feel like my usual self. I gained weight. I'm not sleeping. I'm anxious. I'm depressed. Oh, well, let's check your labs. All your labs are normal. you're fine, right? And they just have you follow that line of fine until you fall off the cliff.
Yep.
Okay, now you have hypertension. Let's give you a pill. Okay, now you have diabetes. Let's give you a pill. And that's what it is. It's what it is. It's the road to failure.
It's the pill for every ill model,
Hmm.
and
Yep.
they just compound. It's I can't imagine being a person in the world right now that doesn't have some knowledge base about nutrition or exercise. Or I'm always trying to empower my audience. I'm always beating my whole platform is about metabolic health, because I'm like, without that, it's all bets are
That's
off.
right.
Like, you
That's right.
cannot have balanced hormones if you don't have good metabolic health, and you
Of
can't have
course
good
not.
metabolic health if you don't have muscle. So, and on around we go in circles. And I'd love to talk to you about that. I think that the message is finally getting out. I've heard you say it. Talk to us about not only avoiding cancer, breast cancer specifically, by having your metabolic health intact and strength training, but also what happens if you do get some kind of chronic illness and you have adequate muscle mass. How does that protect you? Do you feel comfortable talking about that? Because I've heard you touch on it.
Yeah, sure. I mean, the bottom line is that our muscle mass is the thing that we have to protect at all costs as we age, right? And it becomes a tricky thing. It's really, really easy for kids to assimilate protein. And if they're active, which, like, quite frankly, we have an epidemic of childhood obesity now. So if kids are fed even a halfway good diet, they can figure it out if they're active. As we get older, we have a number of physiologic changes. And I'm going to speak more to women than men because it's really the focus of my education and my audience. As we get older and we approach 40, a lot of things are changing. First of all, we are making less stomach acid. So, as we make less stomach acid, our ability to extract, absorb protein, amino acids is diminished. And these are the building blocks for our muscle. So even if you could get by on a carbohydrate rich diet before and like a little bit of protein as you stop making less acid, the other thing that's happening in that age range is that we're perimenopausal. The villainization of estrogen has so harmed, damaged decades of women because we need that estrogen. That estrogen is tremendously important for our health going forward. We go from being someone who could probably do some cardiovascular exercise, eat okay, pretty clean, and we can maintain our metabolic health to we can't hold it together anymore. And by the time you lost muscle mass, you've also lost your metabolic health.
Mm-hmm.
By the time you have replaced, by the time you have fatty infiltration into your muscle and you've lost that muscle mass, you're insulin resistant. Those fat cells, they're not benign. They're not benign. They're secreting lipokines. They are highly, highly, highly inflammatory. And you've changed your chemistry. And a lot of things change with that. You have bone loss along with that. You have heart disease along with that. You have brain fog, recall issues along with that. You have depression. You have anxiety. These are very, very serious medical problems that if we were better at educating our people, we would have a lot less disease. Now, let's say that you know about that and you incorporated resistance training and weightlifting. And, let's say it's someone like you that knows about it. There's still a possibility that you're going to get breast cancer.
Mm-hmm.
It might not be because you have metabolic dysfunction. 80% of breast cancers are a combination of metabolic dysfunction that lead to immune dysfunction. And we know that for 5 or 6 hours after you consume sugar, your natural killer cells are inactive, right? That is your surveillance system for cancer. So if you're eating a sugar bolus, a couple times a day, a yogurt for breakfast and pasta for lunch and something with, rice for dinner, these are sugar boluses on and on and on, and oatmeal the next day. And these are sugar boluses on and on and on. You're not going to have an immune system. And some people have genetics that can hold it together for some time. And some people are like me, or maybe even you, and we don't have a big bucket. Our ability to tolerate toxins is pretty minimal. So even though we've done the right thing and we have muscle mass and we have pretty good metabolic health, what about mold in our homes?
Right.
25% of people lack the enzymes to break down mold. So, I can live clean, I can have metabolic health, but if I can't break down the mold and I become a mold factory, there's something. So, of course, it is always better to start with better health. It is always better for people who come to me with a breast cancer diagnosis who are already healthy, right? That is ideal because then I can figure out what caused this and we can get rid of that and they can move on with their lives. So I'm always prioritizing adequate protein, adequate acid, adequate movement. And that means you got to lift heavy things 2, 3 times a week. You got to make sure that you're sleeping because if you're not sleeping, you're not healing. If you're not sleeping, you're not repairing. So, that ends up being really important. And then we have to be aware and cognizant of those environmental things that influence our health because the breast, the thyroid, these are the canaries in the coal mine.
Yeah.
Right. And the breast is especially an issue because for most women, we have a considerable amount of fat cells in our breast.
Mm-hmm.
And fat cells are where we're going to store the toxin. And so, think about if you have a neighbor that has a bunch of junk on their lawn, eventually it's going to start to spill over onto yours. Well, that's what someone who has a breast, the breast is made up of glandular tissue, of fat cells, of connective tissue that holds everything together, and it's all in a skin envelope. So if the fat cells of the breast are filled with toxins, they're sitting right up against your glandular cells. It's a lot. I know it's a lot for people to handle, and you're not going to be able to do everything, but there are some really easy things that people can do to really move the needle.
Yeah. Let's talk about that.
Things like filtering your water.
Mm-hmm.
I mean, all you have to do is go to the EWG and plug in your zip code, and you will get a list of what's in your water. And I'm telling you, when you see that list, you will not drink that water.
It's sobering.
It is sobering,
Yeah.
right?
It's a
And
good tool
so,
when you travel too. If you're at a hotel somewhere, my husband will say, "Can we drink the tap water?" And I'm like, "Let me consult the internet." And I,
yeah.
type
So
in my
I have
zip.
taken to bringing Brita bottles with me.
Yeah.
And I just, I use them for filtration when I'm traveling. And then, in your home, if all you can afford is to put an RO system beneath your sink and you use that for drinking and cooking, even better if you can put an RO system in your whole house. But we have to filter our water and we
Yes.
have to stop drinking out of plastic in every form. I don't care if it's BPA free, if it like plastic is plastic and we have to call it out for the poison that it is.
Amen.
Right. Yeah.
Yep. Uh-huh.
And then, what you're cooking in, what you're storing in, what you're cooking with. And it's really hard to be healthy unless you eat most of your meals at home.
Mm-hmm.
No,
Agree.
no one is ever going to care about your food the way that you care about your food. And we go out to eat once a week, and I never feel well the next day.
Oh,
We
I
do
always
it.
feel like garbage. I'm
We
like,
do
why did
it
I
to
do that?
I know, we do it to be social and to
Yeah.
and because my family's sick of my cooking, but I never feel well the next day. And it's not like, we're not going to junky restaurants. I don't eat at
Yeah.
Wawa. Do you even know what Wawa is? You probably don't know
No,
what
is
it
that an East Coast thing?
is. It is. But that, you know, No one is ever going to care about your food the way that you care about your food. And then what we're putting on us.
Yes.
We all have to be aware of what we're putting on us. The average woman is putting like 150 chemicals on her skin in the morning before she even starts her day. This is a problem. So, I've taken to totally, totally, totally simple stuff. I use a lot of almond oil on my skin, coconut oil on my skin. If I wear makeup, it's all EWG certified, and it's not worth it. It's not worth it to disrupt your endocrine system to support the beauty brands. It's just not.
100%. And something that I've done, I can't always find the products that I love makeup wise that are super, super clean. I always choose the cleanest I can, but
Yeah.
I don't have to go outside very much. But even so, I use my skin as a gauge of my health. And if my skin needs makeup, then I'm doing something wrong. And if
Yeah.
I put a little bit on, it's on occasion, or I'll try to get all of my recording done on that day or everything I need to do that day. So getting yourself well enough that you don't have to put on makeup in the first place is always my goal. And secondly, if I do wear some makeup, I go home and wash it off as fast as I can. I don't exercise in it to let it in my pores. I don't sauna in it. I mean, there's ways to
Yeah.
sort of adapt
Yeah.
as best we can is all I'm sharing.
I love lipstick though.
I do too. Toxic lipstick is so good.
Well, I don't wear the toxic stuff anymore.
Oh, what
I'm
do you
I'm
use? You
I'm
have to.
proud to say that. So, I have a number of brands that I like that I go to and I switch around. Right now I'm wearing OG.
Oh, okay.
Um,
That's
and
beautiful.
thank you. And I'll go through phases where I love Beauty Counter. And there was a brand that they're not making lipstick anymore, but I loved the Salty Girls when they were making lipsticks in Vermont. And I try to buy everything from either Beauty Counter or Credo, where there's all ingredient transparency. I'm wearing it for when I'm recording. I'm not applying lipstick all day, every
Right.
day. And again, like you don't want to drive yourself crazy. You want to do what you can and you want to do the best you can. And that's it. And you have to create that mindset that I can't control everything. I'm just doing the best I can. And
Hmm.
that goes a long way. But if you think about the things that you can avoid, that really, it doesn't change your life to not clean your house with bleach,
Right.
right? It doesn't change your life to not wear all those commercial makeup brands. It's not changing your life for the worse. It's not changing your life to not store in plastic. It's not changing your life to not drink out of water bottles, right? Like these are changes that you can make that really move the needle far for you that are not so much of a sacrifice.
Completely agree.
Stop wearing perfume, don't
Oh,
have
yes.
scented candles, don't
Right.
have scented anything. Like this isn't changing your life and you don't smell.
Yes. If you're healthy, you really don't smell. And
Yeah.
oh, the young girls with the scented and all the laundry detergents and
Yeah, it's
fabric
awful.
softeners, it makes me insane. And it's these young girls, I'm really concerned about them and their tatas when they get older. I mean, the movement of like that Kardashian movement of that thick makeup and the contouring and the layers and the serums and all it's like, oh, geez.
Yeah.
It's such a process of, and it's just a layering on of toxins. Like you were saying, keep it simple with some. I'm such a tomboy. That's why I was telling you before we hit the record button. It was like, I put on makeup today. We got to record something. This doesn't happen.
Yeah. Yeah. Well, you do look beautiful, but I'm
Oh,
sure
thank
you
you.
look beautiful without makeup.
Well, I
I mean,
try. That's my goal, right? Like
yeah.
that tells
Yeah,
me
I
my
hear you.
hormones and my
And
food
I'm
and
right there with you. 5 days a week, I don't have a stitch of makeup on my face.
yeah.
But, those couple days when you just I don't know. I feel a little brighter, a little giddier when I have a little lipstick on and, maybe a little shadow.
Oh
But
yeah.
again, I'm wearing clean brands and God, definitely not exercising them. God forbid. I go to exercise at 7:30 in the morning. I look like something the cat dragged in.
Good for you though. That's dedication doing those early morning workouts. I can't do it, but I
What
always
I
am in awe of people
find
who can.
if I don't do it and I start my day, it doesn't happen.
Yeah. Oh, and you're probably
Like,
so much more on the ball too, having
yeah, it's
working after
amazing.
exercise.
I hate going there. Right? Like every single day, I tell my trainer, I'm like, I dream of reasons not to be here. Right? But you're for sure glad it's over and you have the whole day ahead of you, which is so amazing.
Yeah, good.
And
Oh,
it really gets your brain going. It
yeah.
really gets your brain going.
We can't be high functioning, smart doctor ladies without the exercise. It's
No,
just not. And I really
no.
do think that success is contingent on your fitness level as well. There's a big component to that. And I say this for everyone.
Yeah.
Even if you're not an entrepreneur and you're not trying to tackle big mountains and or grow big online platforms, right? Like we all need to be successful in our lives, and exercise of any form, really, strength training is so particularly helpful, but it really just gives you an advantage that you don't have without it. And until you feel it and you experience it, it's like a sixth sense. Strength and some level of fitness truly is a sixth sense. It's just such a
Well,
gift that you,
it gives you an awesome feeling of confidence. It's
yes.
like when you know that your body can do that, you feel like on top of the world.
Yeah.
Like when you finish a huge set and you're like, I cannot believe how much weight I just lifted.
Yeah.
Like you just feel on top of the world.
Yeah.
Yeah.
It's so
So,
true.
yeah.
And then when the trolls come at you, you're like, honey, I could deadlift you. Just sit down. Just very good.
Yeah, well, I definitely have trolls that, you know, I kind of feel badly for them. Like my trolls are mostly in the mammographic space
Mm.
where they're radiologists and they say things like, I'm going to kill people because I don't advocate for mammograms, which is really interesting thinking there, right? Like I'm telling people to not get radiated and I'm going to kill them. How does that work?
It's insane. Let's talk about mammograms so I don't keep you all day, because that's really the topic that I want to hit on here. I have read the data. I am not for it, and I never have. I tried to get my mother not I'm so old school. Like 20 years ago, I was like, "Mom, don't go." I studied x-rays in chiropractic college. I know what they do. We studied
Yeah.
them deeply
Yeah.
and on a level that other doctors don't get unless you're a radiologist. And I am not a big fan of imaging of any sort, to be honest with you. I think it really
Well,
drives the
I
health
I
costs
mean,
up and
it
unnecessary
definitely
procedures.
drives the health costs up. And I think we're learning more and more. I mean, we used to think that MRI, we'll touch on the whole MRI and gadolinium
Yeah.
issue, but
Yeah.
just taking the gadolinium out, MRIs, which, are thought to be safe because they don't have radiation, you talk about hanging around those magnets all the time. And now we're seeing huge
Yes.
rates of dementia in the people who are operating the MRI machines and the technicians. This is a
Yes.
problem. Like,
Yes.
read the writing on the walls. This is not good for you.
A
So, you
giant
know,
magnet. Like people need to understand what an MRI is. It's
yeah,
a
it's a
giant
giant
magnet.
magnet. Yeah,
What is that
correct.
doing to the structured water in your body? I mean, it's crazy. I can't even
Yeah,
think about it.
yeah,
I won't get
that,
in one.
that's right.
Okay.
So, really, let's talk about the history of the mammographic screening program because I think that it did start with good intentions, like many things that ended up not being true. I mean, there was a time when doctors were hawking cigarettes, and I remember the days of Celebrex where we were told that, this was the best anti-inflammatory, and like, oh, whoops, it causes, or Vioxx, it causes heart disease, or the very best pain medicine that's not addictive on the market is OxyContin. Like that was what was out when I was a surgical resident. Can't tell you how many prescriptions for OxyContin I wrote. I have no idea how many addicts I created,
Wow.
right? So, we don't always get it right, even when we start with good intentions. Not that those were necessarily examples of good intentions, but with the mammographic screening program that started in the 1970s, it was really built on a platform that believed that breast cancer was both the growth was linear and predictable, And so if you could find a breast cancer early before it reached some critical mass, then you could prevent women from dying because you would prevent metastasis. And it's a lovely, lovely theory, just doesn't happen to be true. So breast cancer growth is neither linear nor predictable. And so we have women who have cancers that are very small with very aggressive biology. And no matter what we do, they don't have a good outcome. And we have women with cancers that are very large with unaggressive biology. And no matter what we do, they have a good outcome, and everyone in between. We have seen population studies from Denmark, from Switzerland, where they look at two populations. They look at women who get screened, women who don't get screened. They have equal access to medical care and medical treatments. And there is absolutely no difference in survival between the women that get screened and the women that don't get screened. This is the difference between them. In the women that get screened, we could potentially save one woman's life in 2000, and we will treat 10 women in 2000 for a disease that they did not need treatment for, that would have never threatened their life. Now, if the treatment for breast cancer were benign, maybe that wouldn't be such a big deal, but it's not. When we treat women for breast cancer, let's start with surgery. We already talked about it. A woman who has a breast amputation is never going to be the same again. Never. She will never see herself the same way. She will never act the same way. She will never feel the same way. For women who have lumpectomy and radiation, they deal with a fibrotic, deformed, painful breast for the rest of their life. There's no benefit in terms of survival with radiation, and yet we do it regularly. Now, women who have radiation to their breast have an increased risk of heart disease, not just of vascular disease of their heart, but cardiomyopathy of the heart, because the muscle of the heart, the actual heart itself, gets fibrotic from the radiation. They deal with bone disease, they deal with lung disease. And these are not inconsequential things. These change the quality and the duration of their life. And then talk about chemotherapy. I mean, chemotherapy changes everything for a woman. It changes her microbiome, it changes her gut, it changes her brain, it changes her bones, it changes her heart, it changes her blood vessels. These are serious things. And most women will have what's called a hormone positive cancer, which, let me just say that it is normal to have estrogen receptors on breast cells. So, it's not such a headline that there are cancers with estrogen and progesterone receptors on them. That is a variation of normal. But when we give these women hormone blockade, we're basically shortening their life, giving them heart disease, giving them brain fog, giving them depression, giving them anxiety, making them more likely to have Alzheimer's, giving them osteopenia and osteoporosis. And as many women die every year as a fracture of a complication of a fracture as do of breast cancer. How are we helping?
Yes.
How are we helping? When we treat women for breast cancer, they are 2 to 3 times more likely to die of heart disease than a woman who was not treated for breast cancer. How are we helping? And literally, with mammogram, with regular mammographic screening, we're causing 5,000 breast cancers every year. 5,000 breast cancers just from screening with mammogram. What are we doing? What are we doing? How are we helping these women? And the answer is that we're not. But we're helping industry a whole hell of a lot, right? Because that breast cancer screening, that creates a lot of customers.
Yep.
And when we look at the data of if we are really finding things early, we find things about 4 or 5 millimeters smaller on mammogram than when people find them on physical examination. That is meaningless.
Yeah, that's a small amount.
It's
That's less
meaningless.
than the size of an eraser head.
Yeah, meaningless. So we are not helping women with mammogram. I don't believe that anyone should have a mammographic screening exam. No, I'm not saying that you'll never have another mammogram again because, if you find something in your breast, that's considered a diagnostic study. And I do think that there's some role, I'm not throwing the baby out with the bathwater. Maybe there's a role for it in diagnostic study. I would argue that an ultrasound is better and far less harmful. So I don't know that you need it. But if your doctor is absolutely insistent, okay, maybe that is a situation where it is permissible, but no one should be getting screening mammograms for any reason ever.
I'm
It
with you.
cannot help you. It can only hurt you, and it will hurt you. And I'm not just talking about the compression, which is traumatic and horrible. I'm not just talking about the pain, right? Because we're tough. Women are tough. And if we know things are for the good, we can do hard things. So it's not about the trauma of the mammogram. It's not about the pain of the mammogram. To me, it's about we are radiating you. We are radiating you. Radiation is a known carcinogen. We know that it causes cancer. And the amazing thing is that you can ask 100 doctors, does radiation cause cancer? Every single one of them will say yes. You ask those same doctors, do mammograms cause cancer? They'll say no, right?
I'm not irradiating my tatas.
Yeah.
I'm not
And
doing
you,
it.
as well, you shouldn't. And I hear the argument all the time. Oh, well, it's not that much radiation, just a little bit of radiation. It's no different than flying cross country. Yes, when you fly cross country on an airplane, there is scattered radiation around you without
Hmm.
question. That is wholly different than coning down that radiation
Yep.
and focusing it on the tissues of your breast. We are not comparing apples to apples. It's a different beast, and
Yep.
it is a beast, and it is hurting people. It's destroying lives. It is leading to over biopsy, over diagnosis, over treatment, and we are not saving lives. And we all took an oath to first do no harm, and this is hurting people. So the time for mammogram, as far as I'm concerned, is over. Over. Now, fortunately, there are other great options,
Yeah. Let's
and
talk
I
about it.
never like to present a problem without providing a solution. So, for years, people embrace thermography, and I am not anti-thermography, but we need to understand what thermography is. So, thermography looks for a heat signal, and that heat is associated with inflammation. Now,
Hmm.
sometimes it will be reflective of a cancer, sometimes it won't. And there are some cancers that are not very quickly growing and not terribly inflammatory and just won't turn up on thermography. And to me, that's okay too, right? That test is not a screening test for cancer. It's a test to identify inflammation. And I think it's a great tool for you to know where you are and where your body is in terms of inflammatory load. And I think it's a great tool for a place to start. Where do you need to focus? What is going on in your body? What is happening? But if you want to use that as a screening tool for breast cancer, it should be done in conjunction with an ultrasound. And ideally, it should be done at the same time by the same provider so
Oh,
that they
cool.
can interpret those studies together.
Yeah. That's good. That's good advice.
Now, the very best screening tool for breast cancer is called a QT scan. And this is a test that has been FDA approved for a little over a year, uses sound waves transmitted through water to create a true three-dimensional image of the breast. And it has 200,000 times more data points than MRI and 40 times the resolution of MRI.
Wow.
So it was originally created to replace MRI because MRIs are uncomfortable, inaccessible, expensive, there's a lot of reasons to not use MRI, not the least of which is that if an MRI is going to be of value for a breast scan, it needs gadolinium. Well, gadolinium is a heavy metal
It's so
and
bad.
it's so bad. And anytime you're putting gadolinium in your body, it's being taken up and stored. And it's always going to be stored at the expense of something that you need. This is a real problem. Not to mention that, like, Hopkins knows that the amount of gadolinium that they've dumped into the surrounding water has made the water toxic.
Oh, yeah. I've been railing against gadolinium for years and years, and nobody wants to hear it. And I'm like, I wouldn't. Do you know how? Okay, so I specialized in musculoskeletal medicine. This is what I did for over a decade. Thousands of patients came through my doors, and I ordered 4 MRIs in my entire career because it didn't change the treatment any. So I was like, well, if you need to see it, and those were usually for litigation because they were in a car accident or,
Yeah.
needed something, some kind of proof. And I would never allow the gadolinium. I'm like, we'll work around it. And I found techs and radiologists who were willing to read these images without gadolinium because I'm like,
Yeah.
do not put that in your veins. That's going
Yeah.
to end up in your brain and your nervous tissue at the very least. It's,
Kidneys. Yep.
oh, it's a
Absolutely.
disaster.
Absolutely. It's a huge issue.
Yeah.
But for many years, it was considered the gold standard to screen women with breast cancer. How horrible is that?
That's insane.
Right? That we're taking women who have already shown us that they can't handle the world around them and we're making their world more toxic. And
Oh,
so, I think we're very, very lucky to live in a time when we know these things and when we can say no. And is the medical profession very slow to admit and adopt? Yeah, for sure they are. They're hanging on, they're clawing on to the old ways, but women know better. Women are smart. And what I say to people is, listen, if your doctor says they won't see you if you won't go get a mammogram, it's time to get a new doctor,
yes.
right? Or again, the amount of times that I have seen mastectomies done for a finding on an MRI and then there be no disease there is too many to count. And so if you have an instinct that says no and your doctor is pressuring you otherwise, it's time to get a new doctor. There are people out there like you and I that understand what's going on.
Mm-hmm.
We understand. And we're not looking for diagnostic imaging to figure it all out for us. We're able to figure it out without all that. And even when we need it, we are using it in a totally different capacity. Like my cancer patients are not getting screened with CAT scans. They're not getting screened with MRIs. I'm following inflammatory markers. I'm following their general health. I can look at you and know if we're on the right track or not. What's the
Yep.
color of your skin look like? Are
Yep.
you puffy? I can know by looking at you
Yep.
in a second and I can say, you look terrific. I know we're on the right path, or uh-oh, what's happening here? And
That's the vital sign. That's the
yeah,
vitality vital sign.
yeah,
It's
absolutely.
I could see it in the
Absolutely.
lobby as I looked at the patient. I still take so much shit from people, and they'll say, "How can you tell someone has metabolic dysfunction?" And I'm like, by looking at them.
Mhm.
How can you not? Like, if you've been in medicine long enough, you start to see it. And if you're looking, I guess if you're paying attention and trusting your gut instinct, I think some of us are gifted with that ability to see things, but absolutely. And the patients can see it. To piggyback on what you said, I so agree with you. I was so mismanaged by the medical system growing up. That's why I chose the path I've chosen. And if you at all feel uncomfortable, go seek out a second opinion. But more than anything, educate yourself. And that's
Mhm.
why I'm so happy that someone like you is speaking out, because just it's been so hard for me to find somebody that would even breach the subject. And you do so eloquently. Find someone who you've got a great book. I love the title, The Smart Person's Guide to Breast Cancer. That's great.
Thank
It's
you.
so simple. And educate yourself, folks. Like that's what this is all about. The more education you have, the more empowered you are. Nobody can take that away from you. And then trust your instincts. And it's easier to trust your instincts and read your body aiming towards health. When you choose the healthy path consistently, you start to, like you did with your Graves' disease, you were like, I'm going to I'm going to do this for a while. And were you not able or better able to read your own instinctual cues, right? To your own health as you gained your health, as
Yeah,
you went.
well, you have to tune into that awareness. And what we need to do more than anything else is stop farming out our health to
Yeah.
people who are not good stewards of our health. And they don't really, that's not their concern. Their concern is not with our health, it's with our disease.
Mhm.
And we have to change the focus. We have to shine the light on the right place. That's one of the fundamental differences between functional medicine or naturopathic medicine or whatever you want to call integrative medicine. That's the fundamental difference between that and conventional medicine is conventional medicine is entirely focused on the symptoms, and we know that the symptoms are not the disease, they're the result of the disease. And there's something else that is driving that. And we also know that health is not the absence of disease. Health is optimal function.
Yes.
And that is always our aim. Like, yes, I want to get you over breast cancer, but I also want to figure out why you have metabolic dysfunction, why you have immune dysfunction. Let's get you healthy. And
Yes.
in a healthy body, disease doesn't happen.
Amen. And if it does, we can nip it in the bud. You know,
Yes.
we're not, I'm not
Yes.
bulletproof. I have my issues. I get my colds and flus just like everyone else, but I trust my immune system and I know what measures to take to improve things. And I've always said, you know, my best friend and mentor died of cancer, and I watched it happen over 2
Oh,
long, horrible years, actually 3, but like the first year he was pretty good. And it was the treatment that killed him. And it was so aggressive. He went after the treatment so aggressively. And it was shocking because he was such a well-known and really a famous naturopathic doctor who'd been in practice for decades. And he just was at that age. He was about my age. He was a little bit older than I am now. And he got caught up with these, yeah, I hate to say it. It's like guys at this age and it was the doctors. They were all like broing out together. They were like, yeah, bro, we're going to get you through this, and it was such an aggressive assault on his vitality. And at the end of the day, it was the cachexia. They had induced this inflammatory cachexia that they couldn't slow down after all of that. And he died. And after that, I realized I am not doing that. So if I ever get that diagnosis, I am not going that route. I'm not going to
yeah.
choose that traditional route. And I know
And
enough cool doctors like you to find other ways. But to say this is why I'm so against screening mammograms for everything you just said, but also like we have to have the conversation with people. What treatment route are you going to choose? If you're not going to choose the heroic medicine, cancer chemo, or, chemo radiation route, then
yeah,
we've got some options out there in the
yeah,
world that maybe people don't know about.
yeah,
So, that's a longer conversation, but that's something I always try to work with my patients. It's like, okay, we can run all these fancy tests for all these things that you're looking to find. How is that going to change the treatment? Right? What are your choices going to be? What's your risk
yeah,
tolerance? Like those are
yeah.
bigger combos,
And
but
sometimes it's hard to overcome the societal pressures.
yeah,
So, your sister might not see things the way that you see them, and she may pressure you, and your friends may pressure you. And I have a number of people whose husbands pressure them, like, we have to do what the doctors say. This is what the doctors say to do. And it's hard to fight it on all fronts.
yeah,
Women write me every single day that their medical oncologists won't treat them unless they get a mammogram. And they're insisting on they have to have 12 cycles of drug, even though they've had a complete response after one or two, right? Like
it's criminal.
it's so impersonal that they're just practicing checklist
Mm,
medicine,
yeah.
and it has nothing to do with the person sitting in front of you. And we all just have to be advocates. We have to be our own advocates. And the people that don't see it the way that you see it, be it your friends, your family, your doctors, you need to leave them in the dust. You have to trust your instinct. You have to dial into yourself because no one is going to know you better than you.
Amen. That is it. That's it.
Yeah.
I love this. It's truly empowering when you can step into those places. And also, I would encourage people to think about that's why I'm so glad you came on the show. I want people to think about this before the things happen. Because when I got together with my husband in 2019, we met and I told him very early, I said, if I ever get cancer, I just want you to know I'm not going the heroic route and I will not be pressured. And my parents know I had a cancer scare when I was 20 something years old. It ended up being ITP, which led me into a life of autoimmune disease. But it was a cancer scare for a few months until they sorted
Hmm.
it out with bone marrow biopsies and all of that. And I learned then what your friends do and what your family does. And, you know, it's funny. People will leave you because they're scared for you. It's all kinds of things happen. And I have those conversations early. My daughter knows where I stand. My husband knows where I stand. My parents know where I stand. There will not be any bullying or pressure. I will choose my path. And so, not to be morbid, but cancer is pretty damn common, you know? The chances
Yeah.
of you and I both having it at some point are pretty good. And so really thinking about these things and we live in a toxic world. How are we going to choose to navigate that path if it presents itself is all.
Yeah. Yeah. Absolutely. I agree. I
Yeah.
agree.
Well, so tell us all the wonderful places to find you because you have all the names are so good. Your podcast name, your book, just share
There's
it
so
all.
many places.
Your
I'm busy.
slogan,
I'm a
the
busy
doc,
girl.
the doctor with the answer to breast cancer. I love it. Everything's good.
So, my website is called Real Health MD, and you can always find me there. All of my social media handles are Dr. Jenn Simmons, and my Jen has two N's. I have a podcast that releases every Monday. It's called Keeping Abreast with Dr. Jen. I
I love
also
that.
have a Facebook group called Keeping Abreast with Dr. Jen, where people come. It's a brilliant community of people who know that there's something better and they're there, thousands of women there supporting each other, which is amazing. And I pop in and out of that group frequently. My first book was called The Smart Person's Guide to Breast Cancer, and that's available now. My next book, called The Smart Woman's Guide to Breast Cancer, will be available next month. And so that's really exciting. And then I have a bunch of imaging centers which are going to open across the United States called Perfection Imaging.
Oh,
The first one
yay.
will be open in the suburbs of Philadelphia, and there are 7 to follow just behind that. So lots and lots and lots of good stuff. And my mission is to change the way that we diagnose, treat, reverse, and prevent breast cancer. And I am going to fulfill that mission.
I love this. I'm so excited for your imaging centers. I did not know that. Well, of course, I didn't
Yeah.
know that. I've only just met you, but I've heard you talk about the QT imaging on
Yeah.
your podcasts and on your socials. And I was wondering, I haven't looked into how available that is or how
Yeah.
readily available. So
Yeah,
this is
so
exciting.
if you follow me on Instagram, which I hope all of you do and all of your listeners do, you'll hear about all of the new openings. And also you can go to our website, which is perfectionimaging.com. And perfection is spelled with QT in the middle.
Okay. Okay.
Yeah.
I will make sure all the links are in the show notes because this
Yeah.
is very
Wonderful.
exciting stuff.
Yeah.
Well, so lovely to speak with you and get to know you a bit today. Thank you so much for your bravery
My
and your
pleasure.
insight. And I love your story and I love all of this. So I really appreciate you coming on the show.
Well, it is my pleasure. I am so grateful to practitioners like you who are out there and truth seekers and helping people to see what's right and what's good. And we need more of you.
Thank you.